Welcome to The Women's Wisdom, our journey in emergency medicine podcast, a production of the Women in Emergency Medicine section of the American Academy of Emergency Medicine. Join Doctors Molly Estes and Liz Calhoun as they are joined by prominent women in emergency medicine and other special guests.
Hello, and welcome to another episode of the Women's Wisdom podcast. My name is Liz Calhoun, and I am an attending physician at Mercy Fitzgerald Hospital in Darby, Pennsylvania.
And hello, everybody. My name is Molly Estes. I'm clinical faculty at Northwestern University in Chicago. And today for this episode, we are very pleased to welcome Dr. Cortlyn Brown. Dr. Brown, would you introduce yourself for us?
Awesome. I'd love to. Thank you guys so much for having me. My name is Cortlyn. I go by my first name, so everybody can call me Cortlyn. Pronouns are she, her, and hers. And I am emergency medicine faculty at Atrium Health Carolinas in Charlotte, North Carolina.
Wonderful. If you hadn't already heard about Cortlyn, she was one of the winners of one of our Women in EM section awards this year, the Gender Diversity Award. So congratulations to you. We're sorry we missed you at the luncheon this year.
Oh, no worries. Thank you guys so much for the award. It's such an honor.
How did you decide to do this thing called emergency medicine in the first place?
Oh, definitely. So I was that kid that always knew they wanted to be a doctor. Like, didn't even think about anything else, didn't want to be a princess, didn't want to be a pilot, literally just always knew I was going to be a doctor. And it started because my dad was sick for the majority of my life. And so I was really raised in the hospital and just saw kind of the good ways that doctors could influence and interact with families, as well as some of the bad ways. And so I wanted to be able to help patients and interact with families similar to how doctors did whenever my dad was in the hospital. So always knew medicine. I was born and raised in Pittsburgh, then did undergrad in Chicago, then did a gap year just to kind of like regroup. And I actually did nothing medicine or pre-med related at all. I played a bunch of sports. I played women's full contact football and ice hockey and just chilled out and had a few kind of side gigs. Then went to med school in Connecticut and then actually came into emergency medicine super, super late. So I had never even thought about emergency medicine besides having a neighbor who did it and thinking that how would you ever know that much? That it just blew my mind thinking that they would be able to handle anything that walked into the door. And so I was really intimidated by emergency medicine. And so I actually dual applied into child psychiatry and emergency medicine because I'm biracial and I really wanted to work with kids with identity development in terms of their ethnicity, kids that were struggling with that or kind of coming to terms or learning about themselves. But then something just didn't feel right about kind of the pace of the work. And so literally as I was completing and filling out my application for residency, one of my friends was like, I feel like I could do emergency medicine. And I did a sub-I as I was completing the application and fell in love with it.
Wow, I feel like there is so much to unpack here, and we're going to have to come back to this gap here in just a minute. But so many questions there, but let's focus on emergency medicine. So clearly you found your passion here in EM, and I can completely understand why with the fast pace. How did that translate into residency and then the rest of your career? And how does the child psych part of you incorporate that into your current practice?
Yeah, so great question. So I thought I was going to incorporate it a lot more. But honestly, and I'll just be very frank about this, I have been very overwhelmed whenever I think about mental health in the emergency department and trying to help our patients. And so when I came into residency, I thought that was going to be my niche. I was going to, make all of these changes. And then I came and I just realized that the resources aren't there, the patients are there, but the resources aren't. And so I actually took a step back from that. Which is not really like me. Normally, I kind of tackle things head on, especially if they seem like they're going to be difficult. So this is really one of the first times in my life when professionally I was overwhelmed and decided just to not tackle something.
I don't think that's a bad approach in any way, shape, or form. I feel like we are presented with so many different struggles and challenges in our attempts to provide the best care we possibly can for our patients with ever decreasing amounts of resources that we really have gotten to a point where most of us have quite honestly decided to pick our battles because we are only human and we can't solve all the problems of all the world all at the same time. I think it's one of the strengths of our specialty is that we are such a diverse group of people that there are people out there, myself not included, who can tackle some of the struggles that our patients with mental health issues face when they do have to come to the emergency room. One of my best friends is a psychiatrist. She does consult liaison psychiatry, and she routinely, we will talk. Well, it's probably free therapy for me, less routine for her, about this moral injury struggle that dealing with mental health crises at the level of the emergency room that we face, because I would bet, unless you practice in a very robust, unique environment, that probably none of us work in places where we feel like it's 100% great for our patients with mental health issues.
No, I definitely agree. One of my close friends is a psychiatrist, and so we talk about that also. I feel so bad for the patients because they're in this, hyperstimulated environment and they're already coming in at a heightened state. And so it's just not a good mesh. And then I also just personally feel like I'm kind of copping out on not tackling it, but I do have to protect myself somewhat. And, we are a resource ourselves, and our energy and just the amount that we can commit to something it is a resource. So yeah, I definitely struggle with that.
But on the flip side, even if you are struggling with that in terms of your professional work environment, you've actually been a really great advocate for diversity and the self-expression of many other people in our profession through the JEDI group. Can you tell us more about how you got involved with AAEM and with JEDI?
Yeah, so I got involved with AAEM as a resident. So I went to UCSF, and the year, I forget which year it was, but maybe my third year, AAEM came up with the Resident Student Association JEDI. I think it was a section then, and they were looking for chairs and vice chairs. And so I thought this seemed like a great opportunity. I didn't know much about AAEM at all, but it seemed like an opportunity where you could really form the group to be whatever your vision was. And so signed up for that, had a great year, and then have kind of just stayed remotely active in AAEM since then. But then a few of the past JEDI, and JEDI is Justice, Equity, Diversity, and Inclusion, a few of the past JEDI section leaders reached out because they were trying to get some new ideas and some fresh faces. And so I got involved, and I served as chair-elect 2 years ago, chair last year, and now the awesome Dr. Kristen Smith will be taken over as chair this year.
So looking at how you initially became involved in the section and then your trajectory into section leadership, how has that involvement augmented your quote unquote normal everyday life and career? Or has it been the opposite? Has your ongoing career in clinical practice augmented your involvement in the dissection and what you can do for its membership?
Ooh, that's a great, difficult question. Can I say all of the above? Is that an option?
That's definitely an option.
So
Answer D, all of the above. Yes.
Perfect. Yep. So I'm in academics, and so my clinical role as well as teaching role is really focused on academics. And so I feel like a lot of the initiatives and ideas and projects that we created in JEDI have kind of come out of my experiences with the students that I've worked with. So one of the projects that we created in JEDI is an HBCU lecture series where we basically we learned that none of the HBCUs, so historically Black colleges and universities, none of them had an academic emergency medicine department. And so if you think about it, if you're fourth year rotating at your home HBCU, you don't have those Thursday morning conferences that the other sub-Is do at different institutions. You don't have that natural mentorship. And so we wanted to create a lecture series, and it's basically core emergency medicine through a DEI lens. And so that really came about because we had a fourth year student who was from an HBCU rotating with us here at Carolinas, and they basically were telling us, you know, of their experiences. So I try and do a lot of overlap that way, if that answers the question.
No, that more than answers the question. That's incredible. So just being involved and aware and attentive to what is going on out there led directly to this incredible education initiative. How cool.
Mhm. And I think one of the things that I love about AAEM and JEDI in general is just, it's literally like if you build it, they will come. Like if you have this idea, there will be people that will be super excited about it, and you'll be given the resources that you need to really make it come to fruition. Like this literally just started as I woke up one day and was like, I wish we could do more for our students at HBCUs for whenever they're not at our institutions. And I spoke to a few people about it. They were super excited. And then everybody kind of rallied around me. And I think that's unique to AAEM.
It absolutely is. And it's one of the most inclusive and welcoming parts of our organization, is that you're exactly right. We are here to support everyone and their ideas, and help make it happen for you. If there's a need somewhere out there that someone recognizes, we're always happy to help support and fulfill it. I think what you're saying is really important for a lot of our younger members to hear about how kind of supportive AAEM is as a whole organization. Do you have any specific tips for any of our younger listeners, our students and our residents, about how to go up and approach someone with any ideas that they have? Because that can be one of the most intimidating things, is just, even if you have an idea and hearing that you're going to get support, is just putting yourself out there. So from that context, how would you explain that or tell that to one of your young residents? What is the best way to put one of your ideas out there?
Yeah, that's a great question. So I would say there's kind of two ways to go about it. So AAEM and any organization has sections, committees, interest groups. So pretty much if there is a topic you're interested in or a project that you want to do, you can find a group that it will fit within. So if you're not sure who to reach out to, you can literally always email whoever's leading that group, and it's all on the website. And literally, worst case, they don't read your email. Like, you've lost nothing. It probably took you maybe 5 minutes to write just a quick email. So you literally just lost 5 minutes. Best case, they take it on. And we have, one of our simulation scenarios at Scientific Assembly 2 years ago was literally born out of an idea that a intern at the time had. He might have been a med student at the time, med student or intern, and he created this whole incredible inclusion simulation project that was done at Scientific Assembly. And it's literally because he emailed some people. So I would say you can either reach out to whoever's involved in leading that group, or literally if your research or whatever you're interested in aligns with some faculty member, or if you think they're just doing cool work, just reach out to us. We are, in general, emergency medicine people are super approachable. And if they're not approachable, nobody is going to be mean and going to send anything negative. They honestly just, the worst case, like I said, they might just not read it, or they might just ignore, and you haven't lost anything. But there's so much to gain just from reaching out.
We couldn't have said it better ourselves. It's actually a point that I make with almost all of my rotating medical students, that because of the stresses of the job, emergency physicians are some of the most non-hierarchical people that you will ever meet within the House of Medicine. Yep. We really don't care. We're just happy and excited to find other people who are happy and excited about the same stuff we are. So
It's
the
so
worst
true.
we will do, yeah, the worst we will do is accidentally miss your email or, ignore your email, but we will never, ever, ever, uh, in any way pour out negativity upon you. So it's a
Yeah.
very low stakes game for reaching out.
Yep. And even
And
if somebody ignores your email, it doesn't, they're honestly still probably happy to get it. They just might not have the bandwidth to respond, but they're never going to think negatively about you for reaching out with an idea or a question. And I remember as a med student going to conferences and getting all of these contact emails and then thinking that they would, like, all of these, bigwig people, they'd get so many emails after conferences, so many med students, so many residents reaching out. Like, I don't want to bother them. I'm sure I'll just be one of the 20 people that email them looking for advice. And now that I'm in that faculty role, you realize it is actually rare for somebody to follow through and email you, even if you gave them your contact information. And so it's awesome if you can be that one person that makes that connection and then really follows up on it.
Couldn't agree more. It's so true. I hand out my email routinely at every conference, and after every conference, I get maybe 3 or 4 people,
Yep.
who end up reaching out. So this is our word of encouragement to all of our listeners out there. If you have an idea, if you think you might be interested, if you want to get involved, just send a quick email. Super easy.
Mm-hmm.
And if you don't hear
Yep.
back, maybe give us a nudge. There's a good chance that I saw your email in my post-night shift haze and completely forgot about it. So my apologies. I swear. Try again. I'll get back to you the second time.
Post-night shift
Yep.
delirium is real, everybody.
You can even pull the "I'm not sure if my email went through" card. I've definitely used that.
It works.
All
We're
the tricks.
humans.
So then in our last few minutes that we have to steal of your time, let's segue away from medicine and get back to that whole full contact football, ice hockey
Oh yeah.
gap year that you took. Maybe
Yep.
just ask you, so what do you like to do in your free time, and how many patients have you tackled in the department?
So I've tackled 0, but I have seen one of our attendings accidentally tackle somebody, not attending here, but attending where I trained, accidentally tackle somebody. They came around the corner fast. The patient came around the corner fast. So luckily we were a trauma center and everybody was fine.
I was going to ask, I'm like, accidentally tackled. Is this like the I fell
Yep.
on it story, or no, it was a true
I know,
accident?
Yep. There's probably like an ICD for that, accidentally tackled initial encounter. But yeah, in my free time, so I actually ride horses. So I have a horse, and that's pretty much where all of my free time, money, blood, sweat, tears, emotions, everything goes.
Okay, that's
yet-
cool.
So you always wanted to be a doctor and not a professional horsewoman, equestrian, and not live and breathe horses as a full-time career? How did you? I feel like that is the dream of so many little girls, is to own a horse, and you actually do. How did you make that happen?
I was going to say the exact same thing. You gave us this whole lead in about how you never wanted to be a princess, but you've got a horse. Come now.
That's true, but it is much less pretty and princessy than you would think. It's a lot of like scooping horse poop and cleaning out their stalls and cleaning dirt off of them and a lot of vet bills.
I'm going to display my incredibly limited horse knowledge right here, right now with the next 2 questions. What type of horse do you have, and how many hands is it?
Oh, those are great. That's some good horse knowledge there. So I have an off-the-track thoroughbred, and he's pretty tall. He's like 16.3 hands, which is definitely on the taller end, and I'm on the shorter end. I'm like 5'2", so it's a pretty funny combination.
Is your horse an ex-racehorse if they're a thoroughbred?
Yeah, he is. He was bred to race. They really thought he was going to be a good racehorse, but turns out he was terrible at it. Like, he hated it. And And now we do eventing, which is kind of confusing. So it's 3 different phases. It's kind of like the emergency medicine of the horse world, honestly, like a little bit of everything. So the first phase is dressage, where they're doing the fancy movements. The second phase is stadium jumping, where they're jumping in an arena. And then the third phase is cross country, where you're out in an open field, galloping as fast as you can, jumping solid objects. And he actually loves it and is so fast. So I think he just didn't like running next to and competing with other horses, because he definitely could be a great racehorse.
He's like, this track is too easy. Give me something a little bit more challenging.
Yeah,
This is
it's too
literally like the
restrictive.
triathlon of emergency medicine horses. Yes.
How often do the two of you end up eventing? I mean, it's challenging enough to do any hobby with our crazy schedules, let alone someone in academics. So how do you fit this into your schedule?
So I'm there at least 4 times a week. The barn, thankfully, is only like 20 minutes away, which is funny because I'm in Charlotte. So you think of, I mean, it's like a big city, but then there's also Horse World just literally right outside. So I go about 4 days a week, and then we compete once every month, once every 2 months. We actually just qualified for nationals, so we'll be going to Kentucky in August, which is super exciting. But that's another thing I love about emergency medicine. I mean, it truly is shift work. And so you can really schedule things as far out as you know. A lot of times we get our schedules months out. And so even though it's weird shifts that I'm working, I'll be able to plan everything. And I know that at this time, if I really need to leave the hospital, I can leave the hospital.
That is just too cool. I have to say, for as many times as we've asked the hobbies question to people on the call, and we've heard some amazing hobbies up to and including dragon boat racing. I think that this definitely this definitely makes our short list of coolest things we've ever heard. So
well, now I need to try dragon boat racing. That's
talk to Crafton Schreier and Bob McNamara.
Yep.
Oh yep.
All right. Well, as a final thought, if you could go back and give yourself one piece of advice at any point in your training, what would it be and when would it be?
I think I would say, well, so I have one motto that I like. It's not really a motto, but like a saying that I like. So it's do what you love and get credit for what you do. So I would say to kind of implement that throughout any phase that anybody's at. We do so much. And I think especially as women, we don't generally ask for the credit that we deserve. We don't seek the credit that we deserve. And so if there's a way to get credit, be it a publication or a grant or an award, or literally just having somebody know your name for what you're already doing and what you love doing, I would definitely focus on that. And then another piece of advice, I would probably say to have fun. I mean, I think our jobs are so incredibly cool. I can't imagine doing anything else. Like we are the only field in medicine where we can treat a CEO of a hospital in one room and then somebody that's unhoused in the next room and be able to provide the same amount of time, resources, literally just be a good doctor for both of them. We don't have to think about insurance status unless we're helping somebody get insurance. So I would say just have fun. I mean, emergency medicine is incredible. I wish I would have realized it earlier because I probably would have just been 100% set on it from early in med school. But everything works out. And if it doesn't, then something else will work out.
Well, thanks again. We hope to see you all at Scientific Assembly next year, including you, Cortlyn. And if we don't see you there, we'll catch you on the next episode of the Women's Wisdom Podcast.
We hope you have enjoyed this podcast from the American Academy of Emergency Medicine. AAEM is a nonprofit professional association of over 8,000 emergency physicians dedicated to board certification and democratic group practice. For more information about AAEM, visit our website at www.aaem.org.